A preterm, premature, or primary baby is a baby born too early or about 3 weeks before the due date. A normal pregnancy period, which is the fetal development, is about 40 weeks. Preterm birth occurs at 37 weeks or earlier. This premature or early birth can pose serious health risks to the mother and baby. According to the World Health Organization report globally, prematurity is the leading cause of death in children under the age of 5 years. Inequalities in survival rates around the world are stark. In low-income settings, half of the babies die at or below 32 weeks, which is 2 months early, due to a lack of feasible, cost-effective care such as warmth, breastfeeding support, and basic care for infections and breathing difficulties. However, in high-income countries, almost all these babies survive. Suboptimal use of technology in middle-income settings is causing an increased burden of disability among preterm babies who survive the neonatal period. Today, on your favorite health TV talk show, The Physicians, we'll be talking about prematurity, the major killer of our newborn. It's another day on your favorite health TV talk show, The Physicians, where your health is our business. Today we are talking on a very important topic, which is prematurity, the major killer of our newborn. My name is Dr. Memuna Yusuf Kadri, and of course with my regular co-host, the delectable.
My name is Dr. Martina Agbere, and welcome to The Physicians, where health is our business, and we always remain our business.
We are doing Anko.
You got the memo, right?
Looking pinky. No, but today we're talking about a very important topic, which
baby
is
colors, really.
Yeah, I think that was subconsciously.
Yes.
Let's be like babies, because we're babies once.
Yes.
Before now.
I was still babies.
I'm not a baby.
I'm still a baby.
Okay, sorry. You are still a baby.
Yes.
Hold it. No grief for anybody.
No, continue. Yes. I know those are baby too.
And let's talk about prematurity. That's the most important thing. Prematurity, the major killer of our newborn. It sounds so heavy. Prematurity, the major killer of our newborn.
Yes, and it's when it occurs before the 37 weeks. So you can imagine a mother who has carried a baby
up to 37 weeks. That's a lot of trauma.
They tell you the baby you go into labor for some reasons, and the baby is coming. Okay, so the baby comes. Everyone is anxious.
Exactly.
The mother in the first instance wouldn't want that baby to come out.
Because she's still waiting for like 2 weeks, 3 weeks, exactly.
Okay? And that baby comes out. So imagine you having that baby in a center that is not prepared to receiving that baby.
And that is where a lot of the challenges come in. Yeah.
So when you're talking about prematurity, you know, in practice, we were told about surfactants. There's surfactants from the 28th week, right? And if a baby that is born before that time, the survival rate is usually very low. Because that is what helps the lungs to function properly for the baby to be able to breathe. So I tell you something that happened with prematurity. A sister actually had challenges. She carried twins at a time. And
no, but with twins, you know, that is a high rate of prematurity.
So her first one was actually twin, but somehow along the line, she stumbled over it, and she fell. In between,
Dr. Martina, you know what? You know this discussion, this story, I think is very vital when we bring in our guests. Yes. Let's not let the cat out. Yes, exactly. Okay. So you know what? She started up with a story, and I'm sure you want to know how this story ended. We have a very beautiful, amazing woman in the studio with us. But before we let the cat out of the bag, we'll be right back after this time out. Do stay tuned. Welcome back. If you are just joining us, of course, this is your favorite health TV talk show, The Physicians, where your health is our business. And now I want to deep dive into the topic of today, which is prematurity, the major killer of our newborn. And of course, with us in the studio today, as we promised you the other time that we are going to bring her back, is no other person than Dr. BEATRICE EZENWA. She's a senior lecturer with University of Lagos. And of course, she's a consultant pediatrician and neonatologist with College of Medicine, also University of Lagos. You're welcome, ma'am.
Thank you very much.
For me, I think this is a topic that the statement is very, it's like a volcanic eruption, like prematurity, the major killer of our newborn. Of course, our viewers are always very intrigued when they see people that are very knowledgeable on our set. So before we even go further and let them know the major issues that we are dealing with here, we want you to just enlighten them about what prematurity just generally means.
Prematurity is having a baby being born before 37 completed weeks of gestation. So the mother carried the baby and delivered the baby before the child reached term. So all over the world, about 15 million babies are born every year that are premature, that are born before that 37 weeks completed weeks. And majority of these, about 80% of these small babies, preterm babies, are actually delivered in low and middle income countries. Such as Nigeria, such as about 75% of these deliveries occurred in Africa and Asia. And Nigeria, when it comes to sub-Saharan Africa, we take the lead. Nigeria is actually the second largest producer of preterm babies in the world. And we are the ones that our babies die most from. You know, we have large population. So when you count the number of babies preterm that are dying, our number comes up very high. Okay, we used to be following India before, but India has done a lot of things, and they are actually we are now overtaking them. Okay, so where our newborns die. And when you talk about under 5 mortality, death in the newborn period, newborn or neonatal age is actually babies who are from the day they are born until their 28 days. Okay. So the death of babies within that first month of life is actually the highest. They are the ones that contribute 1/3 of the under 5 mortality.
Not even the ones
yes, exactly.
No. So and when you now consider those neonatal periods, who are the babies dying in that? The preterm babies take a huge chunk. Okay, another one that do cause are babies who had infection, those who did not cry. But prematurity is the major killer of the newborns.
So what are the causes of this prematurity?
A lot of things do cause being born too soon. Okay, when these babies are born when they are supposed to be born. Okay, the first one is that if a mother has had a previous history of delivering a preterm baby, the likelihood, in short, 70% of the time she's going to deliver another preterm baby. If the mother is a teenage pregnancies, they also have very high risk of delivering preterm babies, or they are older mothers, more than 40 years. And then if a mother has more than one baby in the womb at the same time, is having a twin gestation or a triplet or quadruplet, in short, the higher the number of babies in that womb, the more likely the mother is going to deliver a preterm. It's got to this situation, but if a mother has a quintuplet, like 5 babies at once, she's not likely going to deliver that baby term. It's going to be a preterm baby. And then nowadays we have a lot of in vitro fertilization. Yes. It's also a very high risk for delivering preterm babies. So these are some of the major causes of preterm, and of course low socioeconomic status, because these mothers may be having some chronic conditions which they never manage, either malnutrition or they have chronic hypertension or even pregnancy-induced hypertension. In Nigeria, even in our hospital, when you take a census of what makes this baby come out too early, you find out that hypertension in pregnancy takes a very high cost. So managing it, and if these mothers don't go to for good antenatal care, they may not be able to take care of and bring down those blood pressures.
Right.
Even diabetes too, if it's not well managed, it can lead to them delivering preterm babies. So these are some of the major causes.
Okay, you talked about obviously risk factors, multiple pregnancies, twin pregnancies, actually a risk factor.
Yeah.
But like before, during our own conversation, I tried to tell her a story.
Yes.
What happened? So a sister was pregnant. Was actually a twin, and now became pregnant with twins. Unfortunately, that night she had a domestic accident.
Oh wow!
She tumbled over a stool and she fell, and there was no pain. There was nothing. After a week or two,
she felt everything was fine.
Everything was fine. After a week or two, she started having some pain and went to the hospital, and they said one thing led to the other in the hospital. They said she started having contractions and everything. 36 weeks.
Ooh.
Yes, but it was 36 weeks at that time. And before you know what was happening, in fact, they said it was fine, everything was ready. The hospital said they had the incubators and all this stuff. Lo and behold,
baby was
she went into labor. The first baby came out.
Deliver.
Yes, delivered. That was when they started looking for incubator. They weren't prepared.
They weren't prepared.
Yes.
The baby said, "We are coming out."
Yes, weren't prepared. It took another day. The other baby came out.
Oh whoa!
So she lost.
Okay.
She lost the two.
The babies.
Yes,
two of
so
them.
she lost them. Yeah, they didn't survive because they didn't have the facilities
to help them because no income.
Yeah.
No,
yes, that was actually what happened. So hers was twin pregnancy, and she lost those babies probably because of the trauma. But then the facility were not prepared. Then another one triplets, 3 boys. Her first one was 3 girls. Another was 3 boys. These 3 boys still preterm. They said that they came out 1 week
after the other, and they all lost.
All lost the 3 boys. So, and of course, because of this low income they are talking about, they didn't have the facilities for managing these children. So these are some of the causes. Even if the children, the babies, they come out, managing them is another thing.
Yeah.
So I'm not surprised when you said that we are the second
highest in the world.
Those ones that it's
Yes,
now that we have talked about some of the causes, let's talk about the consequences.
Exactly.
What happens if a baby comes out within that period?
Okay.
The survival rate.
The story you just told now is really very sad. Okay, but when one is expecting a preterm delivery, there are actually things to put in place and then to prepare for. One of them is that if one is having these signs that this delivery is imminent, you need to consider the mother, you need to consider the baby. And in considering, you want both of them to have a good outcome for both of them. Okay, so for the baby, you need to remember depending on the gestational age, I mean, how long the mother has carried that pregnancy, the shorter the gestational age, the more likely you are going to have complications. You are going to have issues with the baby. It may be issues of breathing. That is the major one, because that's the one you face immediately that are coming. If you deliver a baby at 28 weeks, at 27 weeks, okay, the first thing that you're going to manage is the breathing difficulties that are going to, because their lungs are not mature. Okay, and some of the things you need for respiratory support is not readily available. In short, you need things like CPAP, what we call continuous positive airway pressure machine, which is not readily available everywhere. You need also to give them what will also help their lungs to mature, like the surfactant. It's not readily available. And when it's available, it's very, very costly because the people are not importing it as part of drugs. Okay, because of all it's not many people that need it. And so the drug manufacturers consider how much gain are they going to make if they bring it. So they are not going to they are not bringing it in. Before the baby, mother delivers, you also need to prepare that lungs, by giving the mother some drugs while the baby is still inside. And the major one, from what you just said, is that this mother has come to your facility and you know that you cannot be able to take both care of both the mother and the baby. The most important thing is to refer. And the best way to refer that baby is still while inside the mother's womb. It's not when the baby has been born, you give it to the father and the father start running around Lagos looking for where to take the baby to. Okay, by the time the baby comes, these babies, there are so many things they are deficient in. They cannot be able to keep their body temperature. I have had to see babies, they put the baby in carton, give the mother, the father.
Okay,
it's
yes,
usually
the
mother just deliver. They gave the father, and the father put the baby inside carton on top of Okada and then start running to LUTH. Of course, by the time they got there, the baby was stone cold. These babies cannot keep their temperature, and you're running the breeze of that is blowing them everywhere. Okay, so if you fail to transport that baby in utero to a facility where the mother can be taken care of and the baby can be taken care of, the next best way to transport it is if you have a transport incubator, which is not available. So the best option is to put that child in a kangaroo mother care attitude. Put the child on the chest, skin to skin, and then cover it. In that way, whoever is transporting the baby is giving warmth to the baby, can also know when the baby is not breathing also. Okay, and with that one, you can now take the baby to a facility that can be able to take care of that baby.
Is it possible for us at this point to highlight what type of facilities should really that are equipped enough to take in premature babies, and what should we actually be looking out for in such facilities?
Thank you. Some of the things that are needed for managing a preterm actually depends on the gestational age, that is at what age they were born. The very preterm one, the very ones that are very small, they are called small babies. The very small babies may require incubator care. So the facility must have incubator care because these babies cannot be able to maintain their own warmth. So you need something that is going to help them maintain their body temperature, which the incubator can do. Kangaroo mother care too can do it. In short, just now the WHO, the World Health Organization, is advocating early skin to skin for even the very small babies. These babies are prone to having infection. So your facility must have the facility to keep on doing cultures. And let me also just say that before a baby is born preterm, there is actually something causing that baby to come out preterm. So you need to know what was it that was bringing that baby. Sometimes it may be infection in the mother, and these babies come out and they have infection. So you must have facility to be able to also look at what is causing it and be able to treat it. You must do some cultures and not have facility for culturing some things. Like in her own case, she said trauma. The mother fell. So you know what actually brought those babies out. There are some babies also, when they come, they are very small. They cannot eat. You cannot say, we talked about breastfeeding at a time, you have to, the preterm babies, some of them may not suck directly on the breast. So you have to have a facility that knows how to get this express breast milk and feed it to the baby. So they have to do tube feeding for the babies. So if your facility doesn't have this, don't know how to do some of this, you cannot be managing a preterm baby. They also have, like we said, breathing challenges. Their lungs are immature. You may require to give them things like surfactants. You may require to use machines like CPAP or mechanical ventilation to help these babies breathe for some time until they're a bit mature. So depending on what the complications that come with them, they are the ones that have problem when you even feed them. Okay, they start developing necrotizing enterocolitis. So if you don't know how to manage this necrotizing enterocolitis, it will also be very difficult to manage them. Okay, so these are some of the challenges you anticipate. You must have both the facility and the manpower to be able to take
Wow,
care
that's
of
huge.
those.
Facility and
You
manpower.
use one
Yes.
very big term, necrotizing.
Enterocolitis.
Is there a way you can break it down so that
It's actually a disease seen commonly in preterms. Okay, it's a problem with their in their guts, in the stomach. Okay, it comes from infection or from the feeding. They are not tolerating the feeds you're giving, so the stomach starts swelling, and then you check and do x-ray, you find out that the guts is not moving. They are distending and all that. Of course, a gut that is not moving is a problem. It starts swelling, and sometimes it can perforate, and that means it can, there are small punctures. The things that are in the intestine will now go into the peritoneum, and that is a problem, and then cause problem for the child.
So from all that you have said, it just means that prematurity can be managed if the proper
facilities
and the manpower
is available.
Involved. Okay, so what would you tell we're talking about advocacy now, okay? Because it's one thing for a woman to be pregnant, to carry the baby up until that 37 weeks, and it's another thing for the woman to now get proper health care.
Yeah.
Because I believe that if they are actually registered and they follow with their antenatal, the outcome becomes better.
Yeah.
And the reason for antenatal is for them to be able to detect early if there's going to be a challenge, if they're going to do normal delivery, or you're going to use CS, right? So what is the role of advocacy to people, to mothers, and to healthcare providers? If you are not in a position to manage that child, refer. Because I believe that for facilities that don't have the specialists like the gynecologists, obstetricians, they can't have maybe even incubators.
Even the neonatologists, because it's very
important. I know very well that if for cases of prematurity, right, if we have those cases and they want to do a CS in the government setting, in tertiary institutions, they usually will say, the doctor, the gynecologist will say, I need a neonatologist.
Right here, before I do
the delivery.
Thank you so much. This is such a brilliant and, of course, wonderful session we've had. I know we've talked about, neonatal jaundice at a point. Now we're talking about prematurity. And, of course, I'm sure you oblige us if we call you again for more education. On this show, we always want to reduce as much as possible misinformation and disinformation when it comes to health concerns. Once again, thank you very much. So our viewers out there, you've all heard it. The babies, when they want to come out, they will not give you notice. So please, do yourself well. As a pregnant woman, register in a place where you get the requisite antenatal. Ask the right information. The most important thing is also to know whether you are at risk. If you have more than one baby, you are more at risk. Multiple babies is a risk factor for prematurity. And you've heard the statistics. They are golly. We are very poor when it comes to managing babies when they come out. But one very good thing that the World Health Organization is telling us now is that kangaroo, mother to child, and which can keep the baby warm, should in case the baby still decide to come at the time is not supposed to come. But importantly, any facility that must manage prematurity, manpower, and of course the equipment must be available. My name is Dr. Memuna Yusuf Kadri, and of course, till next time, remain blessed.
So, Dr. EZENWA, thank you very much for coming on our program. We did promise that we're going to bring you back, and thank you for obliging us and coming back to talk on prematurity. Of course, now we really know that it's a major killer of the newborns. And to our viewers out there, you have heard it from the professor. I call her professor.
Thank you.
Yes, I call her professor because she's actually very grounded. You saw the way she was just taking it with ease, dissecting it and letting us know that it is what can actually be handled so long as you seek proper health care at the right time. So I just ensure that you keep a date with us next time on The Physicians, because your health will always be our business. Remember to follow us on all our social media platforms, on Instagram, on Facebook, on X. Now they call it X. And of course, we have a lot of episodes, about 250 episodes on our YouTube channel. can just decide to binge on them. Any topic that you want, most of them are actually there. And if you want to be part of our program like Dr. EZENWA here, just go to our website and just send us an email and you'll be right here as our guest. So next time, my name is Dr. Martina Agberie. Stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite. Love yourself.